Welcome back to the Blackletter podcast. We set out to create an entertaining and exciting podcast about law and business. Blackletter, the name, comes from the Gothic typeset. Over time, Blackletter became the only font that English law books were printed in. It made it harder for kind of the common person to understand what the English law books said. Blackletter came to represent something that was law, that was set in stone, that was sort of old and a well-settled fundamental principle of law. We're here to demystify black-letter law. We're here to demystify things that happen in business and law and where those two meet. And I hope you have fun listening. Hi, this is Tom Dunlap. Welcome back to the Blackletter podcast. Thanks for joining us again. With me this week, I've got Darrell Moon. Darrell is the founder of a company called Orriant. Darrell's company has a lot of interesting things that it does around mental health and teamwork and coaching companies and employees in companies. I'm going to let him tell you about that. Darrell has a very interesting background as well. And we're going to kick off our first show with Darrell finding out about how he went from being in the CEO or COO in these really high level positions at hospitals all over the country to launching his own business and what that's all about, what made him decide to do that. And well, Darrell, thanks for joining us. And rather than me talk, why don't you tell us where you come from and what Orriant does?
My goal in life was to be a hospital administrator. That's what I wanted to do for a career. And I got very lucky very early. And while I was still in college, was running two different hospitals as the CFO controller. That launched me into an opportunity to run 10 different hospitals across the country, mostly for Hospital Corporation, which is the largest healthcare system in Utah, California, Texas, South Carolina, Illinois. And during that time, I became very passionate about Edwards Deming's continuous quality improvement processes because the Joint Commission, which is the organization that accredits hospitals, was adopting back in the 1980s or 1990s these new accreditation standards around this idea of continuous quality improvement. Continuous quality improvement into its most simplest basis. It's first, who's the customer? What does the customer want? What are you going to do to monitor whether you're pleasing the customer? And when you find variation in those monitors, how are you going to get those closest to the process to improve the process to take out the monitor so you can please the customer? Well, here I am going from hospital to hospital, teaching the hospitals as either the CEO, COO, or CFO how to implement these principles. And it's very difficult not to step back and look at the entire industry through these Deming lenses. And when you ask the very first question, who's the customer? I sat back and realized, oh my goodness, this has to be the most broken industry in America. Here I sit at the top of the food chain. I'm the administrator of the hospital where most of the money is spent, and I literally get away with working against my customer.
A friend of mine is a CEO of a company that's acquiring obstetrics practices. And he has the same issue. He said the way billing happens, it encourages people to do something like a sonogram, which isn't necessarily required or advantageous for the client, as opposed to other more expensive things where they don't get as much money from the insurance company. So everybody had to have just really interesting to hear that, I would assume that it's across the healthcare industry that this problem persists.
It is. And so as a hospital administrator, my whole job was how do you get doctors to admit to my hospital? Well, they're not the customer. They're not paying for healthcare. And I want to make sure that the patient has a wonderful experience while they're in the hospital, but they pay very little of the healthcare bill either. If you really step back and say, who's the customer of this $4 trillion largest industry in America? Certainly not the insurance companies. They just pass it on. It's business leaders. It's the CEOs of businesses who are willing to pay for these healthcare benefits to attract and retain top talent. And yet I could no more be misaligned with my primary customer than I was. Everything I wanted was against what the customer wanted. It's like, how is it that this largest industry in America can get away with not working for their customer? And it finally got to me to where I said, I have to leave the treatment side, where I literally feel like I'm sitting at the bottom of the cliff, building hospitals. I opened 3 brand new hospitals, waiting for people to fall off so I could make lots of money. Medicine is the holy institution of medical care or medicine where all the wisdom lies. You come be the benefactor of our great wisdom when you fall off the cliff and need us, and we'll make lots of money fixing you. It's
Right.
not about putting the customer, the patient, or those who pay for healthcare at the top of the focus and saying, what if we build healthcare around them? So 25 years ago, I said to my wife, I can no longer be a part of the system that is so perversely aligned with their customer. And so I left the treatment side of healthcare to try to put fences at the top of the cliff and work directly for business leaders who purchase healthcare for their employees.
How does Orion's work?
So Orion is two Latin words that we put together. The word oriri or orai means in Latin to rise up.
Okay.
And riant in Latin means to be happy, to enjoy life, to be of good cheer. So we simply said our whole goal is to help people rise up and enjoy life better. So why not call it a riot? And so what we do is if you take a look at the entire bill of healthcare, $4 trillion, 87.5% can all be traced back to people's lifestyle and behaviors.
Okay.
There lies the root of all healthcare costs. Well, the healthcare system isn't very focused on the root problem because it's making money fixing people after they fall off the cliff. And my thought was if we're going to put a fence at the top of the cliff or even a sign that says, hey, hairpin turn ahead, warning, then
Right.
how we address the root problem, which is helping people make complex behavioral changes so that they can live life healthier and live life to its fullest. And that's what Orion does, is we're all about engaging people, not just a few of the most sick people, but literally the total population in enjoying life to its fullest.
Gotcha. Okay. So the big leap came when you were in hospital administration and you figured out that you weren't doing something that I guess was changing people's lives. You were just benefiting from, I don't want to put words in, but it sounds like you felt like you were benefiting from misery uh,
Exactly.
in some ways, and you wanted to kind of change the paradigm.
One of the
What would you call this side of the industry?
prevention,
The prevention side.
demand management. How do we manage the demand for healthcare? Really, it's about anyone who's buying healthcare benefits for their employees. How do you help them see that we need to invest more money in actually helping people stay out of the healthcare system. Instead of just
Okay.
spending money when people fall off the cliff, why not put a fence at the top of the cliff?
Are you the only company that does this, or are there companies that do something similar? Was this a unique idea that you had? Like, what was the big change there? What is it that's unique about what you do compared to other health preventative? I mean, HMOs and PPOs, they all have preventative care in their plans. But what's unique about what you guys do?
25 years ago when I left the hospital business and
Mhm.
we wanted to support people in making lasting behavioral changes. We had to come up with a term and we literally thought of the word health coach. We thought, let's call these people a health coach. Now,
Okay.
at that same time, back in about 1996, that term started to be used in different parts of the country. Well, now it's a very common term. There's a huge industry of health coaching, but when we started it, we didn't had never heard of that term before.
Fantastic. So the health coach, that's at the time you started your business, that was the paradigm shift. Have you seen other people kind of copy what you're doing? Is that what's happening, or an industry develop alongside of your company?
Well, that's a great question. Actually, there's a huge industry called the wellness industry. Most of the wellness industry, literally over 90% of it, is simply handing people rewards for doing simple tasks. Doesn't really get at the heart of the hardest thing there is to do in healthcare, which is to help people make complex behavior changes. And it's been proven over and over the most effective way to help someone make a behavioral change is not to give them a trinket or a reward to go do something simple like watch a webinar, attend a fair, get your
Right.
biometrics screened. That doesn't engage people in lasting behavioral changes, nor does simply coming and telling someone what to do. I can
Okay.
send a person a coach and say, look, here's the diet program you need. Here's the exercise program you should follow. Here's the stress management program. So go do it. Well, that's the medical model. That's what we do in healthcare. Doctors basically diagnose and provide a treatment plan. That doesn't
Okay.
work in helping people do the hardest thing there is to do in healthcare, which is change behavior. The secret sauce of changing behavior is to build a relationship of trust where the person is willing to be vulnerable and open up about what are their battles that they're
Gotcha.
struggling with inside. Because we all have a part of us that gets in these ruts, that amygdala, that part of our brain that helps us drive somewhere when we're thinking about something else and we get there and we go, how did I get there? Well, that
Gotcha.
amygdala has a tremendous amount of influence over our behavior. And we all struggle with our prefrontal cortex, that reasoning part of our brain that says, I want to change my habits. And yet, when we attempt to, bingo, we simply drop back into those ruts. And the most effective way to help people get out of those ruts is to build a trusting relationship where people are willing to share what their battles are. And then a third party accountability partner, like a health coach, simply partners with that part of our brain that reasons and works together in overcoming slowly and gradually those ruts and adopting new behaviors that take the place where the amygdala now starts doing the other behaviors instead of what it's always done. And therein lies the secret to the hardest thing there is to do in healthcare. It's working one on one, allowing each person to share what battles are most important to them, and the coach supporting them in making those changes. That's where you accomplish population behavior change and population health improvement.
Gotcha. Okay. Well, thank you, Daryl. I mean, it sounds fantastic. It sounds like something I guess companies should look at talking to you if they are looking to improve the use or the usefulness of a healthcare plan. That you enhance healthcare plans and business productivity through preventative healthcare that's in addition to. Final question before we jump to your business problem for next week. Is this something that's covered by insurance carriers? Will they pay for your services, or is it something businesses can get reimbursement from a something like that?
Generally, health insurance plans pay for fixing people. So it's got
Okay.
to be a claim based on a disease or a sickness or an illness. There is a new code that the American Medical Association created for health coaching.
Okay.
Unfortunately, it is a trial code. Most of the large Blue Cross, Aetna, Cigna insurance companies don't pay for that, but self-funded employers who create their own self-funded plan can
Okay.
choose to say, I want that code turned on. I want to provide prevention and I want my employees to be able to interact with a coach and have it go through my plan. Where other employers who may be fully insured, they just simply pay for the coaching based on
I
those
got
people
you.
willing to work with a coach.
Gotcha. And is it a program where the company pays for it and they get it for the whole company? Or do they pay for it like these five employees? I assume there's some HIPAA problem with saying, just help these people. I assume it's a company wide plan.
What we found that really helps the most is you simply say, look, offer it to everybody, but we'll only charge you for the people that use it. And even
Gotcha.
if you know that someone's using it, doesn't mean you know anything about their health. A person with the best health of all, who may be working on a marathon, may choose to
Right.
work with a coach. So just
Gotcha.
because they're working with a coach doesn't mean they have an illness or a sickness or a
Right.
problem.
Okay. So there's no hit. So gotcha. That makes sense. Okay. Well, thank you, Darrell. Well, thank you for joining us for the first segment. I think I understand how everything works. It sounds really neat. I'd actually like to put you in touch with one of my other friends, not a client, but who's doing something in the healthcare industry that's sort of unique and innovative, and maybe you can plug into what they're doing. But they're on the treatment side, and they're putting together many, many treatment practices.
Nice.
But they're looking to change the way the healthcare industry works. So we'll talk about that offline. But thanks for joining us. Thank you, listeners. I am going to actually close the show. I doubled down because I had a few more questions. But when we come back next week with Daryl, we're going to talk about the challenge that Daryl faced in putting together this company and leaving the treatment side of the healthcare industry and jumping over to the preventative side. And we'll hear from him about how he solved that problem. Thanks for joining us. That's all for today's episode of Blackletter. Thanks again for listening. Join us next time when we talk about more Blackletter issues in creative ways. Make sure you subscribe to the podcast so you never miss an episode, and check out our website at blackletterstudios.com.